One of the concerns during this pandemic is that women will not receive the health care that they need, including preventative exams. We still are encouraging women to seek out their preventative care at this time. It is very important, if you're due for your breast cancer screening, that you get your mammogram. It is important that you get your pap smear if you're due for it for cervical cancer screening. This goes the same with colonoscopy and so on. Please do not hesitate to call our office or send us a message through MyChart, and we can help navigate your needs as well as alleviate some of your fears about coming into the clinic. A common question that many of our patients have at this time is, do I need to come in for certain visits, such as birth control? If you are due for an exam or a well woman exam, we would like you to come into clinic. We do have the option of offering a telehealth visit for those patients who are unable to come into clinic. We would like to make sure that we're getting you the right type of birth control for your needs. If you are coming in for a well exam or a problem-based visit, we would like to make sure that when you're coming in, you're not having any symptoms of COVID-19. We would like you to make sure to be wearing a mask. When you enter, there will be a door screener who will ask you a couple of questions before moving on to the next step of checking in. At that point, one of our friendly front desk people will check you in, and then you'll meet with one of our nurses. The process is pretty much the same, except we're all wearing masks and taking a little bit more precaution. Currently, in an effort to decrease COVID-19 exposure risk and keep your family safe, we're asking that you primarily come into your appointments by yourself. We are very fine with you bringing one support person healthy over the age of 12, but if you do decide to come in by yourself, that's fine too. As the COVID-19 pandemic continues, we will be having patients who have gynecologic needs, obstetric needs, who test positive for COVID-19. We want to make sure that we're taking care of you in the setting of having COVID-19. Please contact our office before that appointment. We will likely have a couple of questions to ask you, and when you come in, we're probably going to take a couple extra steps to keep you safe as well as our staff safe. It is vital that you call if you test positive for COVID-19 and you have an upcoming appointment, or please call if you have symptoms of COVID-19 in an upcoming appointment for us to help navigate the next step. Becoming pregnant is a personal choice. It's really important for you to understand that overall, people who are infected with COVID-19 tend to do quite well and have mild symptoms. However, to have that conversation with your OB/GYN clinician can be really powerful to make sure that you're making a well-informed decision as to whether or not this is the time to become pregnant. You ultimately are in charge of that choice. Thank you again for putting your trust in Olmsted Medical Center and the staff who's here to take care of you.